Welcome back to Data Safeguard, LinkedIn, as well as YouTube Live. I am Damodar from Data Safeguard. With me, Sudhir, our founder CEO. Welcome, Sudhir.
Oh, thank you, Damodar. Thank you, Damodar. Appreciate you taking the time to put this together and have us talk to our audience. And hopefully, this event is going to be something that the audience is going to appreciate some of the insights and the knowledge about healthcare data that we're going to share today.
Superb.
And my name
I'm
is
super
Sameer Sahu.
excited. Yeah, thank you, Sudhir. I'm super excited today because today's topic is very close to my heart. Today, we will be exploring healthcare privacy breaches, its causes, consequences, and solutions. So, we'll hear more from Sudhir. So, audience, as you know, healthcare data breaches are a serious problem that can have a significant impact on patients, healthcare organizations, and the healthcare industry as a whole. In recent years, the number of healthcare data breaches has increased dramatically, and the cost of these breaches has also increased. There are few reasons why healthcare data breaches are so common. One reason is that healthcare organizations store a lot of sensitive data about patients and doesn't use protection technique like data redaction. This data can include names, address, date of birth, social security number, medical history, treatment information. The data is valuable to criminals who can use it to commit identity theft, fraud, and other crimes. Also, another reason I was just reading through why healthcare data breaches are so common in that healthcare organizations are often not adequately protected from cyber attacks. So the hackers are constantly looking for ways to break into the healthcare organization's computer system and steal sensitive data. If they are successful, they can gain access to large amount of personal and financial information about the patients. So Sudhir, I would like to understand what are the most common causes of healthcare data privacy breaches?
Well, thank you, Damodar, for this question. It's very intriguing and interesting question. And every person that goes through the healthcare system in United States or North America, that includes Canada or even around the global system, everybody is concerned today that is the hospital, is the provider where I am going, is the doctor that I'm going to, the dentist that I'm going to, or the ophthalmist that I'm going to, or any kind of a healthcare provider that I'm going to, are they safeguarding my data? Are they really protecting my data? Because if my data gets out there, one aspect of the data is the PII data, which is my personal information. If data gets breached and it is out in the open, my life gets into a chaotic situation, because people can apply for a credit card, they can apply for loans using my social security number, and then ultimately it may become my liability and I have to deal with it. So that's one aspect of it. The other aspect is, let's say I do have a certain reason why I'm going to go see a doctor, and I do not want the whole world or the information getting out there.
Yeah.
So HIPAA privacy protects patients from not letting anybody else come to know of their data unless they give permission. Specifically, they are giving some permission, then people can get access to it. But today, what's happening is many of these small to medium as well as larger corporations who are providing the healthcare services, they were not aware of the challenges that would be caused by COVID.
Yeah.
So even though data privacy and cybersecurity, etc., have been in existence for 20 plus years, the companies focused on investing into cybersecurity products. They felt that if I'm able to secure my network, my applications, my data, then nobody can get in, nobody can take it. But hackers figured out how to get in and how to, if there are two products that you are installing or configuring to securitize your network, they know how to break through those in not it doesn't take too long for them to do that. Now, as COVID created higher level of data digitization, and
Yeah.
data digitization caused and turbocharged, the hackers tried to figure out that more and more data, that is PII and PHI, are now available for them to hack into. And if they can breach into those firewalls and are able to take this data, they have a higher value for it, meaning they can sell it on the dark web. They
Mm.
can recreate by using algorithms. They can recreate this data, synthesize this data, and this synthetic data can now be used to apply in multiple countries. They can apply using the same identity. They can apply in multiple countries for loans and credit cards, and so there are hundreds of
Yeah.
different ways a hacker can use this data after they hack into it. But as the data digitization increased, more and more companies now have our data. Our
Mm.
meaning, the consumer's data is now available to the in the platform, but they are not securitized, they are not protected, they are not redacted, they are not masked. See, number of these things that now are causing companies to be now paying the fines. So the government and the agencies are now implementing serious fines on companies like Salesforce and Oracle.
Yeah.
They have a $10 billion class action lawsuit filed against them.
Mm, mm, mm.
Facebook is facing a $5+ billion lawsuit against them. So similarly, there are companies in China, there are companies that are global, British Airways, Capital One, and number of healthcare companies that have the healthcare data. Because of the breach, the higher level of PII data that they have, the breaches are increasing in the healthcare industry. And the healthcare industry now is trying to catch up to it,
Yeah.
saying, okay, now we are facing all these fines anywhere from $150 million to billions of dollars. What do we do? How do we protect this data? So they are starting to look at data privacy, because data privacy deals with it at the source of the data rather than protecting the perimeter. And so as the fines kept on going up, the investment towards data privacy have now increased. And that is how healthcare companies are now trying to find a solution to this huge problem that is now facing the consumer industry.
Great. So another question coming to my mind: how do healthcare organizations detect and respond to these data breaches?
Yeah, so they have to make some investments. Those investments have to be more on the data privacy side.
Mm-hmm.
Their investments already exist in the data security side.
Yeah.
So their perimeters are secured. They have firewalls. They have all kinds of application security, data security, etc. But the data privacy is something new, and the investments are going into it. And data
Yeah.
privacy could be a combination of consent management, could be a combination of GDPR,
Yeah.
could be a combination of HIPAA compliance, etc., etc. Now, California state has its own CPRA, which used to be CCPA earlier,
CPA. Mm.
now renamed to CPRA. Similarly, Colorado and many of the other states, Washington, etc., have now adopted, and they also 7 more states have recently adopted data privacy laws and regulations. So the healthcare companies,
Mm.
they are following these standards. They are trying to bring in the investment and the vendors who can support them meet their data privacy compliance by protecting the data at the source.
Mm.
Now, if the hackers do still break in through the cybersecurity walls that they have been put in, the ability to steal original data goes away once data privacy compliance implementations are complete. Meaning, if you are protecting the data at source, anybody who comes from outside to steal that data will not have any uses for it.
Yeah. Great. So what are the legal and regulatory consequences for the healthcare providers who experience these data breaches?
Yeah, these are significant.
Okay.
HIPAA is the primary in the healthcare industry. HIPAA is the primary, and GDPR also. GDPR is a global, compliance agency that has been implementing this, but HIPAA is primarily in United States and North America.
Mm.
And so combination of those is what is causing the healthcare industry to be rattled as of right now. So they're saying we need to make significant investments in our data privacy laws and regulations so we can be compliant. But the fines and the amount of customer confidence that goes away when there is
Yeah.
a breach.
Mm.
The patients don't feel comfortable, they don't feel secure, so they are starting to look at other healthcare organizations that can provide better protection for their securing their data. So it's a loss of customer confidence,
Yeah.
potential loss of revenue, remediation activity, because they have to protect this, the people, the patients' data that have now been leaked or that has been breached. They have to do remediation act. They may face lawsuits, and those lawsuits can go into significant amounts of money. They have to engage their legal teams. So it's significant amount of effort. If the data breach has already happened, it's significant amount of effort internally, significant amount of fines and loss of customer confidence and customer attrition, which leads to loss of revenue. So it has multi-pronged effect and impact on a healthcare organization.
Yeah, yeah, got you. So one question coming to my mind, let's say being a consumer or a patient, how the healthcare data breach impacts healthcare cost? I mean, it will go up, right? And what measures can be taken to mitigate these financial implications?
So yes, it does increase the cost,
Mhm.
meaning the internal organization cost will go up. They will need to hire more people. They will need to do remediation. They will need to increase their legal team's cost to be able to fight all these lawsuits from different consumers who have been impacted.
Mhm.
And also, they have to track who took our data and then what is being done about it. So
Mm.
that also causes anxiety. That also causes amount of investments to track that information so that they can take remediation action, because remediation is not a one time activity.
Mm.
It's a continuous activity that has to be done to continue to protect, because once the data goes out, then you don't know how and where and how many times this data is being used. So the other things that can be done by
Yeah.
implementing data privacy laws and regulations, meeting compliance, companies can protect that. One,
Yeah.
they will avoid paying the fines. Two, they will increase the confidence of their consumers, their patients who are
Mm.
coming to get service from them, and the doctors and the nurses and everybody else who is working there, and they're collecting all this information from the customers. They also feel that I work for a company that cares for the consumer, cares
Yeah.
for the patient,
Mm.
and we are able to, they take pride in their information that we are able to protect our patients better. So there's a dual pronged, while there is an impact, there is also things that the healthcare organizations can do to protect themselves against it.
Is there any way where the healthcare organizations can educate and train their staff to prevent data breaches resulting from human error?
Yeah, so data privacy training, meaning
Hmm.
why data privacy is important, what is data privacy, why it is important, why we should be protecting our patients' information, right, and not let that get into the wrong hands. Who should have access, meaning access management, RBAC integration to ensure that people who are not supposed to see certain amount of data should not be seeing it. Like the doctor should be saying what kind of prescription has been provided to a specific patient. Like an admin personnel should
Yeah.
not be able to see that, right? They have no reason to see it. The admin personnel see the information. What is your deductible amount? What is the insurance copay that you must make, right? When can I schedule the follow-up information for you? But the doctor should be able to see everything in terms of what is the prescription, what treatment
Yeah.
has been given, what is the disease that this patient has been doing, how long this has been going on. All of that history should be available to the doctors, and the nurses also don't have access to all of that information. They can only see certain information too. So by creating proper level of access for certain sensitive and patient health information data, the company can protect itself better and also provide better level of service to a patient.
Great insight. So we all understand self-help is the best help. Right? No, I'm putting myself, let's say, being a consumer or a patient. How I can actively participate to safeguard my own healthcare and data privacy.
Yeah, there are certain information that you can also take, certain steps
Mm.
that you can take to protect information. Do not easily share your information.
Okay.
Always question why somebody is asking for this information, right? I am at the front desk of a hospital that you're visiting to see
Yeah.
your regular physician to do an annual checkup. And I'm asking you all kinds of information. What is your home address? What is this? What is that?
Mm.
Only because I'm trying to confirm whether you are that same person or not. The
Mm.
moment I go beyond that and I say, well, what's your SSN number? What's your date of birth? What's your credit card
Yeah.
number? And you should be questioning that. Why are you asking for all this information? You don't need
Yeah.
to have access to this information about me. So this is truly not required. So question everything in a nice
Mm.
way, in a professional way. But question, why you asking this and why do you need this before you
Right.
freely share it with everyone?
Absolutely. Great insight. Another question, what are the current technologies and strategies are being employed to secure electronic health records and sensitive patient data?
Yeah, there are certain systems that many of the larger healthcare companies have
Mm.
implemented, like EHR, electronic health records, right? There are companies like Epic Systems and Cerner. These are the two market leaders. But they provide the information. They also help with the workflow. They create the access management system so doctors can see certain information, the front desk can see certain information, the nurse can see certain information, etc. But the data privacy requirements are not being met by these EHR companies, Epic and
Mm.
Cerner, and there might be more, but they do not focus on data privacy, or neither
Mm.
do they focus on data security. So there are
Mm.
other companies that provide, like Palo Alto Network, and many of the other companies that provide. Cisco has, VMware has,
Yep.
Microsoft has. Everybody has security products, right? Depending on where the data lies, if it is in a data center, there are different products. If it is on the cloud, there are different products.
Mm.
If data is moving through certain systems, then there are different products. But
Yep.
what the industry lacks today is a true enterprise level data privacy solution, meaning you can protect the data at source. It
Mm.
doesn't matter where it goes. It doesn't matter where it is and how it is being, kept or secured or unsecured. Even if it is, let's say, unsecured, I mean, that is a no-no in the enterprise world. But let's say for some certain reason, somebody's laptop got stolen,
Mm.
and the hacker got a hold of that data
Yep.
somehow.
Mm.
But if the data is redacted or masked, then you have higher level of security in terms of protecting the data, because the hacker cannot easily get access to it. Now, if it is masked, they can, if it is over a period of
Yep.
time, they can figure out how to unmask it. But if it is redacted, then it is unredactable, meaning you truly cannot use that data. And that's where, if you look at the picture behind me, you can see the
Yeah.
bubble,
Yeah.
meaning we take real data and then we create a data bubble out of it. So let's say it is Dr. Damodar Sahu, but I can see your name, I can get your SSN, I can get
Yeah.
your date of birth, I can get your credit card number, then I can play all kinds of games with you and create havoc in
Yeah.
your life.
Mm.
But if I see only the data bubble and in the shape of a human being, but I don't know any of the real information, I cannot get access
Yeah.
to if I'm a hacker and I'm breached, and all I get is this, and then I lose interest saying, oh, this company has already redacted all the information
Yeah.
that are in lower environment or non-production environment. There is no point in trying to get into this company and trying to breach their data and hack their data and put all of that. Remember, they're also investing significant amount of money, time, and effort to learn how to hack. It's not easy to hack. So
Yep.
doing all of that, they must believe that I can monetize this information. If they believe that I cannot monetize this information, the data becomes useless for them. So this is
Superb.
where
Yeah.
the
Yeah.
healthcare companies can make their investments. They can bring in an enterprise level data privacy solution implemented in real time systems, in unstructured environments, semi structured, structured environments, historical databases, individual files like PDF documents, Excel, Doc, etc., that might be sitting on individual's laptop, as well as SharePoint or Documentum or content management systems. And this is the kind of solution enterprises need today to truly protect the data at the source.
Great. Great insight. So let's talk about best practices. So what best practices should these healthcare organizations follow to ensure compliance with, let's say, data protection regulations like HIPAA and GDPR?
So now HIPAA and GDPR have been in existence for quite some time. Many of
Yeah.
the healthcare organizations have already taken steps to protect meet those compliance requirements at a certain level.
Mm.
But now, with a higher level of data breaches happening, and especially for healthcare data, now there is a significant need for data privacy laws and regulations that are being implemented. And how do
Yeah.
I meet this compliance, right? There are certain best practices. The best practice would be to help the internal organization become more aware of it,
Yeah.
that we are now required to protect the consumer's data. We cannot ignore it anymore. or we cannot say that, oh, it's okay and it'll be fine because we have cybersecurity to protect us, or our
Yeah.
security products will protect us. And that is not the case anymore, because every company that is at a certain size, 25 million and above, they will be audited, and they will have to prove that they are data privacy compliant. Now there are certain aspects of governance that one needs to, like in all the enterprises, need to implement those governance practices, best
Mm.
practices to implement that. How do we handle customer data? What is the customer preference, right? Customers are providing preference that do not sell my data, do not share my data, etc.
Yeah.
Capturing all of that effectively, having those cookie management, consent management applications that can capture all of these GDPR related preferences of the customer, and then implementing, having systems that will implement what is the customer asking for, what is the customer saying, and how do I implement that, what can I do with this data, what I'm not supposed to do with that data, and implementing policies and guidelines and systems to ensure that the best practices are always there. It's not something that you can do it today and forget tomorrow. These are things that data privacy is here now, and it got turbocharged during COVID because of
Yeah.
higher data digitization, but now it is going to stay there and probably be there for the next 100 years.
Yeah.
So the more and more aware internal training, more and more awareness creation that data privacy is here, and that's something that we really have to deal with, that we have avoided, or we managed to get away by not doing anything about it, making investments into bringing in the right products and the solutions, educating their internal teams, and ensuring that those practices are being followed, creating a data privacy organization, hiring somebody who is a chief data privacy officer. So
Mm.
there are many, and these are some of the highlights of how a company can follow these guidelines and become compliant and stay.
Great. Great insight. Yeah. Thank you, Sudhir. Yeah, we know we are building or we are into the future of data privacy and we are building our products in that way. But still, I want to understand from you, is there an example of successful strategies, technologies that have significantly reduced the risk of healthcare data breaches?
Yeah, there are companies that we are aware of, and we have helped many of them. We can't name them, but
Yeah.
there are companies that are, you may think that the larger companies have made those investments and they might be much more further ahead,
Mm.
but truly the medium-sized companies are the ones who have, because they're at the early stage, they started adopting data privacy laws and regulations and believed that they must become compliant. So those are the ones who have done really well, and they have best practices, and they have organizations, they have people,
Mm.
process, and tools in place to um, protect the company against fines, and protect their consumers against data breaches, and being able to provide the level of confidence where their users and patients feel much more confident about it.
Superb. Great. My last question, of this session today, we all know that we are living in an increasingly interconnected digital healthcare ecosystem. How can the healthcare industry collaborate with companies like us, or data privacy and cybersecurity experts to proactively address and prevent data breaches?
Yeah, see, many of the other market segments, like, if you
Yeah.
talk about data privacy, it's reaching its inflection point, meaning
Mhm.
everybody is becoming aware of it. There are more and more states, and in the United States and other countries, globally, it is being recognized. There is always being discussed. Even G20 summit, all the heads of
Yeah.
different countries are talking about it. That how do we protect consumer data? What are some of the things that we can do? So there is discussion happening at the grassroots level, at
Yeah.
the technologist level, at the business owners level, and people who are responsible for data privacy compliance, risk and compliance, and GRC governance, etc., etc.
Yeah.
They are taking all the right steps. They are also creating budgets, saying that I need budget to now implement data privacy solutions, so that we can stay compliant, but we have a social responsibility towards our consumers, towards our patients, towards our people who are using our systems, who are in our
Yeah.
system, our employees, our doctors and advisors, and anybody's data that we are storing. we have a social responsibility, also moral responsibility to protect their data, right? Because we understand now, if somebody's data gets breached, they will be in serious trouble, and it takes, some of them, it might take rebuilding your identity and again creating your credit worthiness again takes years and years, and people suffer from it. So the
Yeah.
companies are making those kind of investments. They are going towards, creating awareness, as well as, one of the things that can happen is create
Yeah.
a data privacy council.
Yeah.
Companies come together, healthcare companies come together, data privacy solution providers come together, and do a brainstorming sessions again and again, like, annually or quarterly, to discuss more of these. This is where the industry is going, these are the solutions that are being built, and larger companies can share what is their use case, right?
Absolutely.
Whereas solution companies are building use cases what they are aware of, but a customer can come in and provide, okay, I have a much more complicated use case, can you build to it, can you create an additional feature that will protect us against this kind of a scenario? So that will help the data privacy solution industry become much more robust and much more mature. This needs to happen at some point of time. This will happen. One of the larger companies, larger healthcare companies, is taking an initiative that we have heard about.
Hmm.
Uh, Once they put the initial team together and invite some of the solution providers to it, others will join. It'll become a revolution that everybody will want to become part of it and provide a solution towards it. And it's
Absolutely.
also a think tank, right? Think tank
Yeah.
and thought leadership, that this is what we can do. Because see, data privacy and data security goes together, they are not
Mm.
separate from each other, right? Because they go together, cyber security experts can also come into it. They can
Mm.
also contribute towards, okay, we protect the outer perimeter, we protect the application, we protect the environment, we protect the infrastructure, we protect the data center, we protect the cloud,
Yeah.
etc., etc. But we are not protecting the data elements. So who will protect the data elements? It is the data privacy solution providers will protect the data elements.
Right. Right.
If those elements are protected, then a combination of data privacy and data security will make the world a better place.
Absolutely. Absolutely. Well said. Thank you very much, Sudhir, for your time and wonderful insights. And thank you, audience. So, navigating, we heard from Sudhir the healthcare data privacy breaches, it causes consequences as well as the solutions. So, navigating the terrain of healthcare privacy breaches require a comprehensive understanding of the causes, recognition of the consequences, and
Yes.
a commitment to implementing robust solutions. By embracing these insights, healthcare organizations can proactively protect patient data privacy, rebuild trust, and ensure the continued delivery of high quality healthcare services in an era of digital innovation and interconnectivity. Yeah. So we will come back with a different topic very soon on data privacy. And I sincerely thank Sudhir for your time. And thank you very much. Thank you, audience.
Thank you, Damodar, for your thought-provoking questions. And this is something that I really enjoy doing. Thank you
Thank
again.
you. Thank you. We'll meet up again. Thank you. Bye.